Hello, this is Dr. Ford Brewer with Prevmed, heart attack, stroke, and cancer prevention. Why rely on treatment when you can prevent it in the first place? Today we're going to talk about thromboxane. What is thromboxane? It's a chemical involved in aspirin testing. First of all, maybe we should ask the question, should I take aspirin? That pendulum has swung back and forth many times. For decades, the American Preventive Services Task Force has recommended aspirin for middle-aged and older individuals for prevention of heart attack and stroke. Recent research has thrown that into question and maybe even gone the other direction. Here's the thing, though. None of the research around this has actually looked at what we need to know in order to make that decision. If you have plaque, which you can see on CIMT, and if you have inflammation, which you can see on testing, blood and urine tests, if you have those two things, you need to decrease your clotting. And therefore, yes, you need aspirin or maybe even something more. Individuals with atrial fib need something more than aspirin. But then there's a question of, okay, how do I know that my aspirin is actually working? There's a test called it's a test of a chemical called thromboxane, and there's a test called Aspirin Works. Let's go back and look at some images. First, just some reminders on what we're looking for. If you remember, we talked about arteries having plaque, and then portions of the plaque being hot or inflamed. If that hot, inflamed plaque breaks through the endothelium or the intima, it can cause a clot. And the clot is what kills you, not the plaque itself, as seen in this artery here of someone who died of a myocardial infarction or a heart attack. This is the endothelium or intima, and this is the clot that was formed when that hot or liquefied plaque broke through and touched the blood stream. Now we're talking about aspirin, so well, let's look at one other version of these images before we get into the biochemical part of it. Remember, you can start forming plaque up here, and it won't show up on things like a routine carotid ultrasound or stress test or those types of tests. We look at CIMT and inflammation tests because we know that we can see plaques way up here. In fact, a stress test is not going to show any symptoms until you have less than half of your lumen open. And as you see, there is a huge amount of inflammation and clot-forming materials being spewed into the bloodstream way before you get to a positive stress test. Now, let's look at the microscopic and the biochemical aspect of what's going on. This is a diagram of the arterial wall again. This is the media, and this is the intima. They really didn't show a lot of plaque in between, and so from that perspective, it's not a great image. But here's what we're looking for. There are things like extracellular material, matrix proteins that are lying around, and a protein called von Willebrands. Now, none of those proteins are touching the blood unless you get a break in the intima. And that's basically what this is showing. You can get all of these different things that start clot formation if you get that break in the intima, or also called the tennis court, or the endothelium of the artery. Now, once you get that break and you get these items, they cause a chemical called thromboxane to start forming sticky adhesions between platelets. And this is the beginning of the clot. There's some other things to look at in this area. You remember NSAIDs, non-steroidal anti-inflammatories? Also aspirin. Both of those drugs or classes of drugs are what we call COX inhibitors. Why are those important? Well, here's the pathway for making thromboxane. And this is thromboxane A2. This is what helps form that clot. It starts with arachidonic acid, and again, NSAIDs and COX-IBs or aspirin impact the ability of the body to transform arachidonic acid into thromboxane. So that's why nonsteroidals are important. That's why aspirin's important in terms of decreasing clot formation. And as you remember, some of the nonsteroidals were taken off the market a couple of decades ago, actually. That's what happens when you get old. Some of the nonsteroidals were taken off the market because they tended to cause heart problems, which, again, you can begin to see. They started causing clotting issues. Now, this is a diagram of the platelet. And what you see up here is a platelet membrane receptor for a chemical called clopidogrel or Plavix. We'll talk about that a little bit later. The point behind this, though, is that there is a long mechanism involving several different steps which creates clot. Now, let's go back to the thing about Aspirin Works. Before we do, let's just make one other comment. If you're on clot-busting drugs like clopidogrel, Plavix, and there's even some thought that if you're on aspirin and you go off of it, you can get an increase in coagulability, an increased formation of clots. This is some of the mechanism behind how that can happen. It's the body adjusting to create that homeostasis. Anyhow, so what is Aspirin Works? It's the only test that I know of that's been FDA approved to look for thromboxane in the urine. Other tests look in the blood, and there are challenges in terms of getting those tests. With Aspirin Works, you can look at, it's not exactly thromboxane, but it's a metabolite of thromboxane, which you find in the urine. If it is very high, then your aspirin's not working because it's not decreasing the thromboxane formation. So therefore, you need to increase your dose. Maybe take 2 baby aspirin instead of 1.